There was a time in my career that we didn't talk about suicide. We didn't talk about these kinds of things. There's burnout that's occurring. There's depression and mental illness. There's substance abuse. The rates of suicide in Dane County had been going up. We need to take away the stigma so that healthcare workers and everyone can go and get the help that they need. We do have experts in this area and we can call on them, but we all need to be aware because the psychiatrist isn't there with us at every moment. All of our staff can identify and ask the appropriate questions, and that's why education to everyone is so important. I'm proud that we're on the leading edge of that with other organizations and that we keep this at the forefront.
UnityPoint Health Meritor became involved with the Zero Suicide Initiative starting in 2015, and what this initiative really looks at is how can we prevent suicide, and that our baseline should be we could prevent every suicide. What makes up Zero Suicide is a lot of different initiatives, both prevention and intervention and education. This is all of our concern. Suicide prevention is everyone's job.
Even if you're on a gen med floor or a heart and vascular floor, you still might get a patient that's experiencing depression and going through some suicidal ideations. As a CNA, it's not something that you would expect to do on a daily basis, and it's definitely something that is great to think about and have in the back of your mind to make sure you are still helping all of your patients out to the best that you can.
I'm responsible for the repair and maintenance of the parking ramp. We've installed a lot of informational signage. We planted trees and shrubs. If someone were to jump or fall off of the ramp, they would land on something somewhat soft. It makes you really feel good when you can walk into a facility and look around and not only say, I did this, but knowing that it's as safe as you can possibly get it.
One of the huge parts of our training program is crisis prevention and intervention. It helps us to identify and respond to individuals who are in a crisis, create that rapport and develop that dialogue in order to get them to want help, to talk to someone. We are able to form these connections with people, and that's our best tool.
As an employee, there are so many ways that you can get involved in preventing suicide. You can certainly engage in the Zero Suicide Initiative. We also encourage all employees to complete the Question, Persuade, Refer suicide prevention training. Anybody can learn important skills of how to identify someone who might be having a suicidal or mental health crisis and intervene in that moment. Engage with your colleagues, engage with patients, family members, friends, and really help reduce the stigma of asking for help around mental health. Everybody has challenges at different times in their lives, and everybody will in some way be directly affected by mental health issues. So the more that you can normalize talking about it, asking for help, and providing support to others, the better we all can work together to help prevent suicide. You all are important. What you do matters so much. Our patients, their families, our communities, your families, your friends all rely on you. Taking care of yourself is the best thing that you can do to continue showing up and providing the care that everyone around you needs.
I want folks to know all of what's happening at Meritor with suicide prevention. I think it's easy to assume or to think that suicide prevention only happens on inpatient psychiatric units or with outpatient behavioral health clinicians, and it's just not true. People who are not trained in behavioral health sometimes have the most impact on folks when they're suicidal. So I want folks to know all of the efforts that are happening, and even more so to step up to the challenge and make this a priority as a healthcare provider, to know that they have the power and the ability to screen for suicide, to help someone who's suicidal, even if it's just offering support, validating their pain, and being willing to hear their story.